My name is Lisa Covell. I'm a family nurse practitioner. I've been working at Unity for the last 11 years. I see patients from birth to death, and that's what I do here.
So my name is Mary Colbrenner. I've worked in this particular clinic for about 3 years. I've worked for Unity Healthcare for 17 years, and I am a family practice doctor.
I've been working with Unity Healthcare and at Brentwood for about 4 years now. I am a family nurse practitioner. I was a nurse before that, and I did family health with child protective services is one of the other versions
My name
of
is
it.
Teresa Alquiviva. I'm a family nurse practitioner. I've been at Unity for 15 years, I believe, and I've been working as a nurse practitioner for like 34 years.
I think that with the variety of patients we have coming in who English is not their first language, and even if it's their second language, it's not the one they're most comfortable with. When people are talking about their health, it's very hard for them to always express themselves clearly and accurately if they're using a second language or if they don't know what they're talking about at all.
I think if you have a diverse population, you have to meet their needs. And so what I would say is I just had this experience where a woman came in and she was with her two sons, and one son was like 8 and one was 3. And the 8-year-old spoke English, and I started to talk to the woman, and she said, "My English isn't great." And the son piped up, No, I'm good. I'll translate. And I looked at him, and I looked at the mom, and I said, I looked at the son. I said, "I know that he can, but do you think that's the best idea?" And she said, "Absolutely, please no, because I don't." She just was like, "It's too much responsibility, and he's not good. He's not faithful," is really basically what she said, right? I mean, that must be a Spanish translation because her English wasn't terrible. She's like, "He's not faithful," and I was like, "Right." So I called a language line, and you learn a lot more, right? I mean, you can't. Medicine, people want to think that like medicine is about truth, but medicine is not about truth. Medicine is about stories. So this mom came in to talk to me, and the story that mattered is the kid was sick, got better, and then got sick again. And that fact that he got better and got sick again is more important than anything I saw on exam, right?
Yeah.
That's why I knew, and the kid had an ear infection, so I gave him antibiotics. But that piece of information, which sounds so stupid, it's really granular. It's really hard to get timeline information without a translator. You just can't do it.
Yeah.
And so I just, using translators takes a long time. It doubles the amount of time you spend with the patient, and we're scheduled every 15 minutes. And it's sort of a nightmare because if I need to say it, the translator needs to say it, the patient needs to say it, the translator needs to say it. That's how it works. By definition, it takes twice as long. And yet I saw 20 patients today, and I saw 3 in translation. I used a translator for 3 of them because I had another patient who was Arabic who went to the ER to see if a pregnancy was viable because she was bleeding, and she was super frightened that her pregnancy wasn't viable. And I started to talk to her because, again, her English appeared okay. And then I was like, "Should we get a translator?" She said, "Please." And I was able to reassure her because I could actually communicate with her, which I couldn't do. I couldn't do that other than to be like diminishing, like, "You're fine," as opposed to explaining.
Sure.
Anyway, so.
Because without it, I literally can't treat a sizable portion of our patients. I have patients who are Chinese, I have patients who speak Amharic, I have patients who speak Spanish solely, and I do not possess the language skills to take care of patients from all over the world. I mean, I have a patient who also speaks Arabic, right? Like, I just wouldn't be able to take care of them.
Well, I think it's really important in that in order to really assist someone, we need to be able to understand them and to help someone to feel comfortable in order to be able to communicate.
I would say that more than 10 years ago, I've been working as a nurse for about 40 years. I would say that it used to be that we would either bring in a dictionary and write down the questions, or we would use a family member as a translator. And that was certainly better than the options that we had otherwise, which was none. But I think in the last 10 to 15 years, there's been an increased feeling that it's the right of patients to have the ability to use their native languages when they're discussing their health. And so as a result of that, we have, for instance, translators online. Our company pays for those translators to be available for us to use. It works better because not only are they trained in medical language, whereas family members are not always, but it also bypasses the family dynamics that may come into play with a husband speaking over his wife or family members answering the questions for somebody else.
I mean, I don't know if this speaks to a greater phenomenon or just my own practice.
Sure.
But I see a lot more African patients. I do a lot more Amharic. I do a lot more patients in Arabic. And the location where I work now borders more Latino communities. So I do more of that. But I don't feel like the difference for me is I feel like I'm seeing a lot more Arabic and Amharic.
I can only really speak to the last 4 years here, and I would say in Colorado, because of the work that I did was in home visitation or at the county facility, I didn't work with patients who weren't English speaking in that environment because I literally couldn't provide them services in their home like that. I would say it's often really region dependent, right? When I was in Colorado and I was in the hospitals, we had majority Spanish speaking patients were our non-English speaking patients.
Sure.
And since it was really just sort of two languages that you needed to nail down, most people often got very proficient in Spanish so that they could better treat patients and access without the language line. But how has it changed? There's just been an increased need in a variety of languages, right? So like in Colorado where it was just sort of a bilingual situation, here you have a much greater need for all of the languages.
Yeah, definitely. I think we have more diverse populations, and I think we've done a better job of actually helping to meet the needs of, at least here anyway, of meeting the needs of our patients who, don't speak the English language.
I mean, like, I don't think that I really don't. I think that health centers would put the effort forward if it was in their budget, but it seems like the kind of thing that in a crunch is a line item that could quickly get lost. And so I think that having legal requirements forces them to not to make sure that that access is available one way or the other.
I think that sometimes an ad hoc interpreter is fine if you're discussing family dynamics, things like that. As a general rule, I think a professional translator is always better, but my provisos for that is that sometimes our professional translators are not as good as other ones are. So there are times when they're really just not much better than the family translator. And then there are times when there is no translator available for whatever reason. Sometimes there's just nobody available. And when that happens, rather than turning a patient away and charging them for a visit that they can't really know what's going on, or me trying to write things down or using a dictionary, then I think that that's adequate. So I don't think that it should be banned, but I think it should be like the third resort.
Well, I think we're a federally funded health center, and I think we are mandated to have translation. I don't think it's a choice for us. I think it's a law, and we use the language line, and we can do anything. Like, we can do Mandarin, Chinese, you know what I mean?
Yeah.
So I don't think there's ever really a good reason not to use a translator on the phone. I will say that I don't always do it. The times I don't use a translator, I use a family member is often when it's an older patient with a child.
Okay.
And they really seem to want their children, like I'll say, do you want a language? I mean, I don't think it needs to be banned. I mean, I guess it's like anything else. Like if people, it only needs to be banned if people aren't invested in communicating, right?
Okay, yeah.
But if people are invested in communicating, I have to think about this. I have to think about whether I make a mistake when I let a child do it. And I definitely do, and I don't mean a young child. I mean, I'm talking about when I have an 80-year-old patient and a 60-year-old kid. Or an 80-year-old and a 50-year-old.
Yeah.
And it does seem that the older, the really old elderly patients like the interaction with their children. If I ever get any whiff that they're disagreeing or they're arguing, I mean, I had a Chinese patient, and you know, the Chinese language, people scream at each other, and I got a translator because I was like, is this adversarial? And it turned out it wasn't, right? Okay. But I don't know, should it be banned? It probably should be banned, and yet I sometimes do it. How's that?
It's a toss-up, right? Because like, I know that when I bring Glennis or Maria into a visit, I know that they speak Spanish really well. Yeah. And I know that they are adequately conveying the things that I'm saying. Often patients will have family members who come, and despite the fact that you are not supposed to let the family member translate, they want the family member to translate. Sometimes I feel like there's a better quality happening. Wow. And that I'm getting better background information. And sometimes I feel like I say a yes or no question and they talk about it for 5 minutes and I'm clearly not, and I get some totally left field answer that has nothing to do with what we were talking about. And so in those instances it really fails. I would say that also happens with the medical interpreters through the language line. So sometimes it's not the most reliable tool.
Have you ever had a child act as an ad hoc interpreter?
Absolutely.
Yeah?
Yes.
What are your thoughts on that, just on like the emotional perspective of it?
You know, I feel like that's a bigger life situation, right? Because that child is probably not only acting in that role here, and it probably has really taken on that role all over for their family. And so it's probably at the bank, it's at the grocery store, and it, you know, I have parents who are, they do not speak English at all, and their like 8-year-old kid will come to the visit, and even if I have the interpreter on the phone, the kid will just talk and the mom won't be, you know, it leads to some confusion. I think that it probably could go either way for them, right? They could either take on a real skill set and know how to navigate things at a really early age, or might feel really burdened and uncomfortable. And it's also sort of like not anybody's business, right? Like when I have to talk to them when they want their kid to translate, and I'm talking to them about like their pap smear. Like, sure, I feel like there should be a little line for people, some privacy somewhere.
So I think actually that has a number of concerns. One is that it puts a lot of responsibility on the family member. So you don't really know what the level of understanding is of the family member. It also does not protect the privacy of the person that you're caring for. Sure. And you know, the person who you're asking the questions of may be very limited in what they want to share, because either it's a sensitive topic, or they may not want their family member to really know what's going on. So yeah, I mean, I think that you know, it's not the most ideal situation.
Sure.
Yeah.
Have you had instances where perhaps a child acted as an ad hoc interpreter for a parent at the clinic?
There have been times where, and yes, but what we do in that situation is we call the language line. So there's times where a child, I wouldn't say a small child, but maybe like a teenager, will want to assist their parent because they're used to that role.
Yeah.
And so they may just kind of naturally go into that. So there may be times where they will say, like, I wouldn't say that, you know, we immediately say no, not at all, but maybe they'll help with providing a little bit of instruction, but in terms of the actual getting the medical information, you know, we use the interpreter.
Medical interpreter in the room is always better, because then they can pick up all the facial things and the dynamics, and it's easier to repeat things over the phone or to indicate things physically that people can see rather than over the phone where they can't.
Use the language line.
We use the language line.
Yeah.
And sometimes I will use like Google Translate to put my instructions into another language on my visit summary. If I feel like there's something that really needs to get written down and conveyed to the patient, I write it in English, put it in Google Translate, and then put it on my note. I would say I have a moderate level of confidence that the things that I put on there, sometimes I will check with someone who speaks, if it's in Spanish, because I sometimes feel like maybe some essence of what's happening might get lost on Google Translate.
if we had on site, that would probably be a lot nicer.
Mm-hmm.
One of the telephone, it seems like it takes longer because a number of things. One is that they can't hear well. So, for example, this is up here, but the
Yeah.
patient might be sitting over there,
Sure.
and the interpreter can't hear them. So,
Mhm.
as a result, the patient has to get up and move closer to the phone, and so there's just a lot of physical barriers that make the whole visit take a lot longer. Whereas if you have somebody that's on site, it just makes it a lot smoother, you know. And there's also
Yeah.
more of a bonding between that person on site as opposed to through the phone.
Mm-hmm.
And there is a quite a bit of variation in terms of the quality of the interpretation.
Each time you use
each
it?
time.
Ones we had most recently was a parent whose family who spoke Mandarin, and the husband and wife came in, and we were unable to get a translator at that time because there was no Mandarin interpreter available. So we were sort of doing a lot of sign language and writing down words and gesticulating and things like that. And I felt like at the end of that visit that I really hadn't done a very good job, and I wasn't really even sure if I had actually addressed the issues of the patients. And I felt sort of a desperate need to get out of the room because I felt so bad about the job that I was
Yeah.
doing.
I mean, for me, I feel like it's just about being able to communicate with people. I think that communicating with people, I don't think the medical profession does a really good job of communicating with people in their primary language. So when both people speak the same language, I'm not sure we're doing a great job.
Mm-hmm.
And so because we're rushed, because we don't have enough time, because medicine is much more complicated than people want it to be. Like, it's
Yeah.
not cut and dry. It's
Yeah.
often really ambiguous. And
Mhm.
so what I would say is, for me, all communication is the biggest hurdle I face. So if I have someone in translation, I certainly don't want to add that without a translator.